Welcome back to Your Life. I'm your host, Dr. Anna Marie. I don't know about you, but I can still remember hearing scary stories as a child about going to see the dentist. Fortunately, I have gotten over my fears, but I seriously think this is a topic every new parent should be aware of. Matter of fact, maybe your child's first birthday present should be a trip to see the dentist. You won't find any anxiety in Dr. Richard Olin's waiting room. Now, most kids are afraid of the dentist, but not Dr. Olin's young patients who don't seem to have a care in the world. Ditto for his dentist chair, where kids handle exams and cleanings like seasoned veterans. In fact, the younger the better, at least in terms of creating a comfort zone around tooth care.
Well, I think it's a lot more fun and it's a lot more exciting for the child when they're at age 1 than if they wait until they're age 3 or 4 and they've unfortunately had preconceived notions that this may not be as much fun. So if we introduce them at a young age, we got them. And they seem to enjoy it, and every 6 months, if we repeat it and continue to excel on it, we're sold. They're sold. Taking good care of your teeth?
Yes.
You're brushing and flossing?
Yes.
All right.
Dr. Olin has created the My First Tooth Club, which promotes good dental health and helps take the fear out of a visit to the dentist. When Nicholas's mom brought him in to see Dr. Olin for a dental emergency, the visit was smooth sailing, thanks to the staff's caring manner.
To prepare him, I said, obviously, you did something to your tooth. Your tooth shouldn't be gray, just the way sometimes your throat hurts and we have to go to the doctor. Well, this is the dentist, and he will be able to look at your tooth and tell you what's wrong and fix it if you can.
The first visit is mostly an observational one, where they come in, they have a fun visit, they're meeting the dental assistant, the receptionist, they're meeting the hygienist, they're coming in and riding the chair, they're seeing a teddy bear, where we dress the teddy bear up such as what we normally would do when we are coming into an operatory, wearing a mask, wearing glasses, putting on gloves. So we dress the teddy bear, and the teddy bear is like a little dentist. Yeah, it's fun. It's a great little way of breaking the ice, and the child seems to like it. I like it. And we get to have Mr. Tickle. We test it on the fingernail, and all these fun things.
We're going to tickle your teeth, Andrew, just like we're going to tickle your finger.
We usually go to the dentist regularly. It's twice a year, and he's much, much better. It's a lot easier. He knows what to expect, and it's more of, okay, what flavor fluoride or what flavor polish am I going to choose? When he goes now, he walks into the room, he hops into the chair and asks for, can I have a bubblegum flavored polish this time? Or I think I'll go with the mint fluoride, or can I have the toothbrush that looks like, whatever, or whatever flavor. He'll just ask for things that he knows he's familiar with. He's just used to it. He's comfortable with the dentist.
My belief is that they should treat the dentist visit no different than if they went to the mall or if they went to go to shop at the supermarket. And that is, they wouldn't spend a lot of time telling the child about the nooks and crannies of the supermarket and warning them that there's going to be problems at the shopping mall. I don't think there's a child at all that comes in that isn't a little anxious. Even adults are going to be anxious. But if they come in at a young age, we know that we can introduce them at such a fun environment that they're going to be won over. By the first birthday, bring that child to the dentist, get the child used to coming to the office, meet the personnel, have their teeth looked at, have a very fun, exciting visit, get a toy out of the treasure chest and say, you know what, we'll see you in 6 months. And then from those observational visits, those first visits, come a little bit more inclusive visits later on, where we start checking the teeth and getting the child used to sitting in the chair, seeing the sunny lamp, and eventually that child's going to be a very cooperative patient.
For the rest of their life.
For the rest of their life. They'll learn how to take care of their teeth at a very young age.
For more healthy dental tips for your child, log on to our website, yourlifetv.com.